Continuing our cancer awareness today, we are joined by Dr. Douglas Anderson. He's a medical oncologist at Portneuf Medical Center. And Dr. Anderson, first I gotta compliment your unique way of joining the No Shave November team.
Yes, No Shave November is for cancer awareness, yes, particularly prostate cancer. And I'm often accused of being rather baby-faced, as you can imagine. So maybe this will help me look a little older.
Perfect. I think it's memorable, so I think it'll do the trick.
There you go.
All right, so we have talked a lot about breast cancer, of course, the last month for October, Breast Cancer Awareness Month, but there are more than 100 different types of cancer. So just tell us some of the risk factors for really any type of cancer, things people should kind of know or look out for.
Sure. The first thing I would say risk is if you're having any sort of symptoms. And I'm sure they've talked somewhat about this, but if you're having anything new that you're deciding about whether you should see somebody about, just go and get seen. Blood in the stool, for example, it needs to be checked out to make sure that you're okay. The other major risk factor is getting older. The older you are, the more likely that you could develop cancer. And then, of course, being male or female, there's different types of cancers. So being aware and seeing your doctor regularly to make sure that you catch something early if it does happen.
And of course, there are a lot of risk factors that can't be changed, things like age, genetics, but there are other things like perhaps lifestyle risks that you can control. So what are maybe some suggestions or things that people can watch for there to help lower the risk of cancer?
Yeah, general healthy living goes a long way. Smoking is associated with many different types of cancer, as well as alcohol and obesity are all associated with cancer. So living healthy, eating a good diet, exercising goes quite a long way.
And now let's shift gears a little bit and talk about treatment. So say we've now been diagnosed with a form of cancer. What does treatment look like? How do you go about treating each case and making people as comfortable as they can be in this process?
Absolutely. So when it comes to treatment, it depends on what our goal is. Sometimes we're able to cure the cancer, and so we're real aggressive. Sometimes we're looking to what we call palliation, just making them feel better and live as long as possible. And so we talk about that, and I, as a medical oncologist, I'm kind of the quarterback, I put it. I'm helping them understand what's going on and getting them to the right people, and often that includes surgery, who you've interviewed, and radiation oncology to do some radiation if needed. And then myself, I help with hormone therapy or chemotherapy, immune therapy. Thankfully, we have a very comprehensive team, and we're able to kind of knit this all together for patients.
And you mentioned this just a minute ago, you know, if there's anything that looks off or you feel is off, go in, get checked, talk to your doctor, get a screening. But a lot of people, you know, I think there's a fear factor there of what they'll hear if they do go in. So, you know, as a doctor, any advice for people there?
Yeah, the unknown is the worst part of cancer. People are so anxious when they're coming in and worried that they have a cancer, but really not knowing is the worst part of it. It's much better to just know where you're at, get it taken care of, than sitting there and being worried all that time. And the earlier we catch things, the much better it is. Like I mentioned, curative versus making somebody feel good. Of course we want to go for curative. And the earlier we find it, the earlier you come and checked out, the more likely we'll be able to do that for you.
Okay, perfect. Dr. Anderson, thank you so much for taking time to be here with us today. We really appreciate it.
No problem.
Thank you so much.